So, thank you for having me. I am Jennifer McClellan Johnson. I'm one of the counselors at Cleveland Clinic. I work with our employee assistance program where I do counseling. I do presentations and trainings around the enterprise. And I'm really appreciative. I have not been here in Lake County doing presentations, so thank you very much for having me. I have been doing counseling for over 30 years, and today we're going to talk about depression, which is a depressing topic, but it's an important topic, and I'm going to just give you a high-level overview of that topic. Oftentimes a result of setbacks, things that happen to us, losses, job changes, people moving away, things that happen in our friendships. And Sigmund Freud called that everyday misery. Okay, so those are the things that you just accept because you're living and things happen. Okay, so Sigmund Freud called those everyday misery. And those bad feelings that we experience during those types of everyday miseries is something that's expected, okay? And if we're lucky, we get through it, okay? And if we're even more lucky, we grow from it, from the experience. But when those feelings persist and when they impair your daily functioning, that's when we need to be worrying about it and reaching out and getting some help. If the duration is long, if the symptoms are severe, that's when you know it's not everyday misery, okay? And, you know, some people just think that we need to pull ourselves up by our bootstraps and get over it and be strong, but no. There's help out there for people who are suffering from depression. And depression really has been alluded to for thousands of years. And early English texts refer to it as melancholia. Have we all heard of that before? Okay, so that's just another term for depression. Quickly, I just want you to look at this slide because it compares depression and anxiety. Sometimes people come in and they say, well, I feel depressed or I feel anxious and I don't know which one it is. And really it's not up to them to diagnose, but I just want you to see a quick comparison of some of the symptoms. Frustration, sadness, irritability, thoughts of suicide or death, tiredness, disturbance of sleep or appetite. That is depression. Then there's some overlap, which you see in the middle, restlessness, excessive worrying, unexplained physical complaints, both for anxiety and depression. Then let's look at some of the symptoms of anxiety. Trembling, increased breathing rate, feeling nervous, feeling powerless, high heart rate, sweating. You know, sometimes people are so anxious that they can't drive, okay? And so those are the differences and the similarities and the overlap. But what we're going to talk about today is depression, okay? Because oftentimes I have clients who come in, and I counsel employees at the Cleveland Clinic. So I'm part of the employee assistance program. And when I talk to them, they don't know the difference. They just know they feel bad, okay? But let's get on with some conversation about depression. So I'm going to ask you some true-false questions. Medication is the only way to treat anxiety and depression. True or false? Excellent, excellent. Depression is an expected and normal part of aging. True or false? I would say false. Don't expect it. It can happen, and it's, you know, at a pretty high rate. Now, I'll get to that in a minute, okay? Just don't expect it. 20% of people aged 55 or over experience some type of mental illness. True or false? It's true. Only nervous people experience anxiety. Okay, that's false. That was a light false. It's false, okay? You know how some people say, oh, she's nervous. She's got a problem with her nerves. But no, not only nervous people, all kinds of people can experience anxiety, and it's not necessarily anxiety to the point where it's debilitating, okay? And then the last one, men experience depression twice as much as women. Is it true or false?
False.
Good. So that's really good. We'll get into some of those more in depth in a minute. So exactly what is depression? It's a negative mood associated with many symptoms. It impacts your total being, okay? Physical, emotional, and it's not just feeling sad. It can impact your physicality as well, okay? It negatively impacts your activities, your daily function. You can't eat, maybe you can't sleep, maybe you're sleeping too much, okay? It's often a reaction to a real or perceived loss. Most often, the real loss can precipitate some depression. And it's common, it's very treatable, and it is a medical illness. Some people might say, oh, she's just weak. Oh, he's just weak. They just can't get it together. But it is a medical diagnosis, okay? Each person deals with their depression in a different way. Each person presents in a different way, okay? So it's not cookie cutter, it's individualized. And people, again, this is a very important note, and I just said it, I just said a sentence about this, but oftentimes you can't just get over it because it is a medical diagnosis, especially if you have the type of depression that's impacted by hormones, okay? It is not in your head. It is something to be dealt with. There is help available, okay? So that last one, depression often takes on a life of its own. It does, because without treatment, people can get worse. And without treatment, sometimes, unfortunately, people may commit suicide. Okay, that's the extreme. So here's some of the symptoms. I have 3 slides of symptoms. Everyone's symptoms are not the same. Okay, so if you look at a friend and they say, oh, I'm depressed and I'm taking X, Y, and Z and I'm getting counseling, that may not be how you feel, and you might be depressed too. Okay, you may have an issue with depression. So here's some of the symptoms. And because this part is so important, I want to go through every one. I'm not going to expound on every one, but I just want to go through them. Persistent, sad, anxious, or empty mood. Some people just say, oh, I feel nothing. So they may not look depressed, but they know they're not feeling anything. No joy, no nothing. Feelings of hopelessness, just negativity, pessimism, just being completely irritable, feelings of guilt, worthlessness. You might not think that feelings of guilt would be a sign or a symptom of depression, but it is. Worthlessness or helplessness. Now this is a big one. Decreased energy or fatigue. You may find some people who are depressed and they just can't get out the bed. They can't get out the bed, they can't get dressed, they can't get out the house. That is that symptom. Difficulty sleeping, waking up at 2 in the morning and can't go back to sleep. Or oversleeping. So that shows you how it can be this way or this way. Loss of interest or pleasure in hobbies or activities. Things that used to bring you pleasure no longer bring you pleasure. You could take it or leave it, or you just probably leave it, okay? And that's really one of the things that people can look at a good friend or close family member. I know they used to really love this thing, but now when I call for them to join me doing this activity, they don't care anything about it. That is a definite sign of depression. Moving or talking more slowly, feeling restless, having trouble sitting still. Now see, that looks like anxiety, doesn't it? Okay, it's one of those overlaps. Difficulty concentrating, remembering, or making decisions. It's not necessarily a sign of, as you get older, you start feeling like, oh my God, do I have dementia? Or do I have some other brain disease? It could be a sign of depression. Okay? Here's some more. Appetite and or weight changes. Some people eat more, some people eat less. Some people lose weight, some people gain weight. This is where your medical provider comes in. When you see some things in you that are not quite right or are different from the way they used to be, please reach out to your doctor. Okay, don't try to diagnose yourself. There is a lot of help available. Thoughts of death or suicide attempts. And this one is really interesting. Aches or pains, headaches, cramps, digestive problems without a clear physical cause. So you might go to the doctor and say, oh, doctor, I've been having, headaches. And they do a full neurological workup and they do this and that and they can't find anything. It could be a sign or symptom of depression if you put them together with other symptoms. So that last point, in order to get a diagnosis of depression, you have to have had at least 5 of these symptoms present during the same 2-week period. So if you have an appetite problem for a couple days, that's generally not a sign of depression. But when you start putting all these symptoms together and they're lasting for a period of time, then that's when you should be concerned. Any questions or comments? I know this is not a happy topic. I applaud you for coming. All right, so let's talk about some of the causes of depression. Some people say there's a genetic predisposition for depression. Sometimes they say it runs in families. However, there are people who have depression who have no family history. Okay, so these are just some of the potential causes. Environmental causes would be after a serious loss or a divorce, a serious financial problem, losing your home, being in a stressful environment, a change in your life. Now, it could be a change that you thought was desired, and then the change happens and it's nothing like you imagined it would be. So let's say retirement. I don't know how many people in here are retired, but sometimes people retire and they think it's going to be so wonderful and so great, but they lose their routine, they lose some of their, they're not in contact with their friends, they can't get into like hobbies or part-time work, whatever it was they thought was going to happen magically when they retire, it doesn't. And some people who are retired become depressed. And then some of those people go back to work. Okay? Some of that is because of how important interconnectedness with other people is. You can't retire and just go home and sit down in front of the TV. Okay? I can guarantee you that won't work well. Okay? But some people do. So personality characteristics. Some people who have low self-esteem or are pessimistic, negative Nellies, negative Neils, they are more prone to developing depression. Okay, if you don't see a positive outlook, if you don't have a positive outlook and you're mired in negativity all the time, that can predispose you to be depressed. Biological. So the research says that this cause of depression is constantly being studied extensively. But what they're saying is that there are certain neurotransmitters, certain hormones, certain parts of the limbic system, the endocrine system that cause people to be depressed. You can't fix that at home. Okay, you need to go in and see your physician. And that's the only way to figure it out, to have a good team of people working with you. And then a combination of things. The genetic predisposition, your psychological state, environmental and or biological factors can contribute to a depressive disorder. So it's not just one thing. So here's some forms of depression. Major depression is when you have 5 of the 9 symptoms that we talked about, okay? Minor depression is when you have fewer than that. And that is, without getting into too much detail, that's how a counselor or a psychologist or a therapist will kind of look at what are your symptoms? What was the onset? What's the duration? And that will let them know if it's major depression or minor depression. Either way, the person's not feeling good. Okay, one person's feeling a little bit worse than the other. Bipolar disorder, that is when the mood cycles between mania and severe lows in depression. So a person might be manic. I don't know if you guys have seen the commercial that talks about a medication to take for bipolar disorder, but you see the person and she's writing on these little Post-it notes and she's like moving in fast motion and she's running to her computer and she's going back to a book and then she's writing on a board. That's mania. Or people who run out and they shop. That's mania. And then when they come down into a depression, they look around and if the person's mania includes shopping, they may have like stacks and stacks and stacks of unopened boxes from things that they've ordered online, okay? And then they cycle in and out of mania and depression. How many of you have heard of bipolar disorder? Okay. Okay, so really that's what that is. Dysthymia is really low-grade chronic symptoms of depression that last for a minimum of 2 years. The person with dysthymia is not enjoying anything. They're just kind of going through the motions. So people who have the major depressive disorder, close to 50% of them feel like they want to die. Okay, 33% consider suicide and 8.8% report an attempt. Okay, and that's a serious thing. And it, you know, when people go and talk to counselors or talk to their physician, that is a serious sign of depression and something needs to happen in terms of treatment. So more than 90% of those who commit suicide do have a diagnosable psychiatric illness at the time of their death. It's usually depression, but sometimes it's also alcohol and or drug abuse or both. Okay, and that's called, my thoughts are leaving my head. Thank you. It is dual diagnosis, okay? And a lot of the research, and I did a little bit more research before I came here, but a lot of the research is saying they don't know which comes first. It's like the chicken or the egg. Does the alcoholism come first and then the depression, or the depression and then the alcoholism and or drug use? They really don't know. Have another quiz for you. Okay. Compared to men, women experience depression half as much, twice as much, 10 times as much, or the same amount. Twice as much. It's twice as much. Now, I don't know if it's because women are more likely to report their feelings than men, but the stats say, and still say, it's twice as much, okay? The following depression symptom is less likely to be found among men than women: anxiety, physical pain, increases in weight or changes in appetite, oversleeping, outwardly expressed anger or hostility, or all of the above? So, how many say anxiety? How many say physical pain? How many say increases in weight and appetite changes? Okay. Oversleeping. Okay. Outwardly expressed anger and hostility. Okay. And all of the above. Okay. It's all of the above. Women and men have the same rates of depression until age 4 to 5 or school entry, 11 to 13 or puberty, 18 to 20 or menopause, or anytime 41 to 59. How many say 4 to 5 or school entry? Okay. 11 to 13 or puberty. Okay. 18 to 20. Okay. And menopause, or anytime 41 to 59. Okay. So it is 11 to 13, puberty. And the research is thinking it's hormonal. It's the different hormones that are surging in a young girl's body as opposed to a boy's body. I know. Yeah, I do have people who are bringing in their young teens for counseling. And probably they're not bringing them in young enough. And probably what happens with these young depressed girls is that their parents think, and reasonably so, this is just like early adolescent angst, and this is how girls are. This is hormonal, it'll pass. And then they bring them in when they're like 14 and 15, when things are getting a lot worse, yeah. Okay. Postpartum depression is a disorder that occurs in a mother after the birth of a child, the result of really not wanting to have a baby, a normal occurrence after giving birth, or likely to go away on its own without treatment. So how many of you think a disorder that occurs in a mother after the birth of a child? Okay. How many of you think it's likely to go away on its own without treatment? Okay, so we're thinking it's the first one? It is. It is. I'm not going to try to fool you on that one. So this one is really an important point, because a lot of people think that a little postpartum blues is normal and mom will get over it, and on and on and on. No, it is a medical issue, and they say 9 to 16% of mothers experience postpartum depression. It can be debilitating, and in extreme cases can lead to postpartum psychosis, and in really extreme cases can lead to suicide and or harm to the baby. Okay, so just know that if you have a loved one who has just had a baby and it's just doesn't seem right, the bonding isn't there, they don't want to feed the baby, maybe they've started trying to breastfeed and they pull back, or whatever the case may be, just be alert and be aware, and know that kind of thing is not normal. Okay, so there's postpartum blues, and that might be, a mom who is staying at home, not being fulfilled in their workplace because they're at home with the baby. Maybe they're not happy about their weight, or things like that. That's just a change. There's that word again. Change in the household, change in the family structure. Okay, But when depression comes, that is not normal. And that should not be something that is expected, okay? Waiting can be dangerous to both mom and the baby. All right, you guys are doing really well. Factors that may influence depression treatment that women must specifically consider include birth control pills, menstrual cycle, pregnancy, or all of the above. Good, good. All those are hormonal things, aren't they? Okay, and those changes start back in that puberty, okay? So yeah. Okay, you guys did really well. Good job. So who is at risk for depression? So when you first look at this, would you think it's older adults and young adults? Because those are two of the high-risk groups. Anyone can become depressed, but the at-risk groups for depressive illness are older adults, young adults, and we talked about women. Okay, women, pregnant, and postpartum women. Is that a surprise to anybody in here? That older adults is at the top? What do you think might be some of the causes of that? Yes?
Worried about your health and
life expectancy.
Worries about health, life expectancy. Losses.
lack of social skills, being socialized.
So, lack of social skills.
Well, actually, lack of being with people, socializing.
Yes. Lack of socializing. Anyone else? Yes. Financial changes, all that. And all those things that you all said were in slides and slides ago when we talked about causes, right? I think one of the most important things is what you said, and that is lack of socialization. There's a lot of research out there that says that the most important aspect of maintaining good emotional and psychiatric health is social connectedness. Not how much money we have, not whatever, but social connectedness versus being isolated. And there's a good body of research out there about how important it is. We may not think so, but it is. Yes, sir.
Yeah, just as you get older, you start losing your friends and your relatives, so that isolation starts taking hold at that point.
Right. Did you all hear in the back? It sure does. It does. And then it's at that point that you may need, or we may need some help reaching out and developing new networks or new connections. And another thing about older people is that sometimes they hide what's happening to them from their friends and family members. So we may have a person who is, in their 70s or 80s, and their kids may not really know because they're putting up, a facade of wellness. Okay? All right. Anything else? Those were good. Yes, please.
As you get older, today's world moves so fast.
Yes, it does.
That you feel sometimes that you can't keep up.
Keep up. Mm-hmm.
And that causes some depression and some insecurities as well.
Right. Good point. Excellent point. Did you all hear him in the back? I agree with you. Thank you. Anyone else? Okay. Couple quick slides about men and women, just some differences. With men, and not every man, but in general, there is less willingness to talk about feelings. I'm strong, I'm the head of the household, nothing gets me down. it'll pass, whatever the case may be, okay? Call those guys, they're he-men. Like, depressed? No, I'm not depressed. Sad? No, I'm not sad. I'm okay. Yet, this person may be unable to get out the bed. Yet, this person's not going anywhere with their friends or family members. Men are prone to hide their emotions and may appear to be angry, irritable, and or aggressive when in fact, they are depressed. They're more likely to go seek health care due to physical illnesses, physical symptoms, and not emotional symptoms. Okay? And men are less likely to even recognize that they're depressed. And some of that is like, societal programming. It's like you're not supposed to be depressed. You're supposed to be strong, and you're supposed to be supporting your family. And, you have kids, you have grandkids. You can't be weak. Remember we talked about that at the very beginning? To me, it's not a sign of weakness to go to your doctor and say, hey, I'm feeling down. I think I need some help. That's a sign of strength, to actually expose yourself like that. Okay, so that's where the strength comes in. Yes, ma'am.
What kind of treatment does the doctor give you for depression?
We'll get to that.
Okay.
Yeah. Thank you for asking that question. That's a good question. A lot of people are resistant to take medication. So we'll get to that. Thank you. All right, depression in women is the second leading cause of disease-related disability among women. I have more clients who are women and have over my years of doing counseling who need to be on disability or FMLA because of depression than men. Again, it could be because the men aren't coming forth and saying, hey, I need some help. Okay? 1 in 4 women will suffer from a major depressive episode. So depressive episode, that doesn't mean that you're depressed forever. That's an episode. Okay? And women of childbearing age are at an increased risk of major depression. We talked about that already. Depression in older adults. I'm not going to read all this to you, but the numbers are kind of staggering. Of the nearly 35 million Americans aged 65 or older, an estimated 22 million have a depressive illness, either major depressive disorder, dysthymic disorder, or bipolar disorder. That's a lot of people, okay? It's one of the most common conditions associated with suicide and or attempted suicide in older adults. And there's a high suicide rate among older people, 85 and older. So think of 85 and older and all the points that you all were making about social isolation, how fast the world moves, losing loved ones. At that age, you might even be losing your children, right? So that's another reason. High suicide rates is largely accounted for by white men. Then we get back to how men are socialized to be the strong ones. So they may not be sharing how they feel. Depression in young adults. 10% of college students have been diagnosed with depression, including 13% of college women. Most of our colleges, and I would probably say at this point in the game, all of our colleges probably have a psychological center or a counseling center, because it's not only challenging to be away at school, there are high expectations, you feel isolated. Some people are away from their families for the first time, some people don't make friends. There are a lot of reasons, and then some people are perhaps predisposed to depression. Some people are coming into college with a depressive disorder, diagnosed sometimes and undiagnosed sometimes. Some parents set up supports for their kids when they go away to college. And then the kid doesn't want to feel like they're different, so they don't follow up and use the services that a parent has sought out and set up for them. We see that all the time, okay? So what are some of the additional risk factors for depression? We talked about those. Family or personal history of depression. If you've had a major depressive episode before, you're more prone to have another one than someone who hasn't had one at all. A current substance abuse problem, a major life stressor, which you talked about, okay? Loss of a loved one, loss of a job, loss of a home, loss of a feeling of security, right? Let's just put it like that, loss of a feeling of security. And chronic disease. You will find that people who have had major heart disease are more prone to depression. Coronary disease, more prone to depression. You feel uncertain, you feel unsure, yes.
Question, what other diseases are related to depression than heart disease?
I will have to say I don't know of any others. However, heart disease is the first one. Another one is people who have to have transplants. That would be another one that I've had some experience with some patients, employees who have had transplants, and I've had spouses of, people who have had transplants, and depression is very high. Do you know of any more?
Cancer.
I think
Yes.
chronic pain.
Chronic pain?
Chronic pain.
Yes, that's true. And someone up here said cancer, so. And rightly so. I mean, I wouldn't expect people not to be depressed. All right, let's look at the psychosocial and environmental factors. Neighborhood social disorganization could be, it depends on the neighborhood you live in, depends on how much money you're making. If you're below the poverty line, you're more likely to be depressed. Things that you would think would be factors environmentally or psychosocially. Those numbers are pretty high though, aren't they? Yeah. So some people say, well, why is she so depressed? Well, may not have money for food, may not have good lodging, may have to live in a bad neighborhood where they're afraid all the time. I mean, it's just a lot of different issues.
Afraid of losing your house.
Afraid of losing your home, exactly. But those numbers are really high. So what's the depression burden? And when I say burden, I mean the burden to society and to the particular person who is having the depression. The first one is, we talked about it, if it's untreated, and sometimes if it is, it can lead to disability, and most tragically, as the slide says, suicide. There are some people with depressive disorders have an increased prevalence of chronic disease, asthma, diabetes, and I would venture to say that some people, like if they have diabetes already and they're depressed, maybe they don't care. I'm not using my insulin. I'm not taking my metformin for what? I don't care anymore, okay? And then what happens? They end up in the hospital with some medical crisis, and it's almost like a cycle with some people. End up in the emergency room. Another burden is that people who are depressed really are more likely to engage in behaviors that contribute to poor health. Again, like smoking, drinking too much, poor eating habits, depressive disorders really are the projected to become the leading cause of disability, and the second leading contributor to the disease by 2020. So we're in 2020. I will see at the end of 2020 what the stats are. Okay, but I would say that that second point is probably true. Okay. U.S. workers with depression cost employers an estimated $44 billion per year. Why? Healthcare, time off, disability, FMLA, I mean, family medical leave. All right, so here we are at seasonal affective disorder. There is a handout specifically about seasonal affective disorder, but it is how many of you know what SAD is? Seasonal, okay, so you guys are good. You already know. Okay. It's a form of depression related to change in the seasons, and your handout, which is one of the white papers, goes into more detail about it, but it begins in the fall through the winter months when there is less natural sunlight and the days are shorter. And the symptoms could include lack of energy, overeating, sadness, mood shift, difficulty with sleep, and loss of interest in activities. There's that losing interest in activities. So what are some of the causes? Your biological clock is impacted by the lack of sunlight. Does everybody get out in the sun every day? There was sun yesterday. I used my sunglasses. Right. I used my sunglasses yesterday. I picked them up maybe 4 weeks ago. I haven't had to use them. Haven't been able to use them and see. Serotonin levels, living far from the equator, and melatonin levels. So what I read was the lack of sun increases your melatonin levels, and as you know, there's a supplement called melatonin that helps you sleep. So that results in the sluggishness, the fatigue. I have an office that has no light, no windows, and I get up from my desk at least once every, 2 hours. So this is the light box. That's one of the treatments. And getting back to what's happened with me, I was complaining to my director, this office with no light is doing something to me that I don't like. It's making me feel sad. It's making me feel sluggish. It's making me feel ineffective in my work. I mean, I counsel people. I don't need to be sad and sluggish. So, I can't. So what she ended up doing was bringing one of these light boxes to me. She said, I have a light box at home. I'll bring it to you. And so I use it on my desk when I get in first thing in the morning and a couple times during the day. What that does is it imitates, and there are more details in your handout, and I'm not an expert on this, but it imitates the amount of lumens that you would get from sun if we had sun. And it should, they say it raises your mood, okay? Have you all heard of the light boxes before? Mm-hmm. Do any of you have one at home? So what other treatment is available? Medications, increased exercise, creating social situations, and some of the complications of seasonal affective disorder, social withdrawal, school problems, work problems, the things that you would expect with any other type of depression. And some people think that it's not a real thing, but it really is. It really is. Yes?
Discern the difference then, because it happens when the sunlight changes?
So,
The difference, or what is what has these symptoms?
a lot of people come in, if adults come in with seasonal affective disorder, they know it because It happens to me every, October, and I feel okay in April or whatever it is. So that helps the, whoever the clinician is, helps them to ascertain what it is. Okay. Anything else? Okay. Yes.
Walking at the mall helps, I think, because it's so bright in the mall.
Mm-hmm.
And even if it's
Artificial
cloudy
light,
outside,
right?
Yeah, it's really bright.
It really
And the
is.
walking helps.
It does. It helps boost your serotonin, yes.
Is that a special lamp or light, or can you use any light if you're working at your desk and you put a brighter light at the desk?
I mean, I'm sure a brighter light would help, but it's a special lamp. It's a special type of bulb. Mm-hmm.
So it's not a sun lamp?
No. No, I remember those. No, it's a specific type of light. Okay? All right. So we're going to zoom on here because I'm running out of time. I know. So let me just say that how many of you have a primary care provider, a doctor that knows you and you know him or her? Okay. So they are the person who probably would usually help diagnose a depression, okay? And quite often, the first type of questionnaire they use is this 2-question patient health questionnaire. And, you can take this and fill it out, and if you have checked anything on here, I would like for you to share it with your physician. Okay?
How do you get someone to go to their physician if they've got the symptoms and they refuse to go?
I know, that's frustrating. That's frustrating. All you can do is try to support them and continue to lovingly encourage them to follow up with their health care, okay? And that's very frustrating. Did you want one of these? Okay. All right, so, at your convenience, just look at this questionnaire because this is probably the first thing that a physician or a doctor's office would do. It's just a basic screening, okay? It's not the diagnostic tool, but it screens to see if you may be in need of additional support and further testing, okay? But these are some of the things that we talked about, and they're pretty simple. Little interest or pleasure in doing things, especially if they're things that you have found, had great interest or got pleasure from doing in the past, and feeling down, depressed, or hopeless. Again, it is a screening tool. It's not to establish a final diagnosis or to monitor depression. But I want you to do it, and if you take that and it looks like something that, I've checked this and I checked this, then take it into your physician, okay? Or nurse practitioner, whoever your person is, okay? All right, as far as counseling is concerned, these are some of the things that you should look for from your healthcare provider who is going to be doing your counseling or helping you through your depression. Explore treatment options with hope. Okay, not, oh man, you're depressed, you're gonna be depressed forever. If someone says that, you need to get another counselor. They need to be able to be aware of the possible stigma associated with coming in and saying, perhaps I have a mental illness, because there is a stigma attached. And they need to be able to be compassionate. They need to be able to ensure that everything you talk about is confidential. They need to be culturally sensitive and support the patient's family. Okay? Treatment options, finally. So a lot of people I see who I think would benefit from some type of psychopharmacology are resistant to it for whatever reason. They don't want to take anything. They want to try other things first. So counseling or psychotherapy is one of the methods that is used, okay? Pharmacotherapy is what they're calling it, which would be medications. A lot of the medications, and some of you may already be on some medication, they are outlined in one of those articles that I gave you. Oftentimes we use a combination of medication, antidepressants, and counseling, and then there are alternative therapies. So that would include being able to do some type of reflexology, yoga, meditation, guided imagery, acupuncture, and a lot of those are outlined in one of your articles as well, okay? And those are considered alternative treatments. But a lot of people want to start with those, okay? If they have a mild depression, they may want to start with those, okay? Everybody doesn't really need to be in therapy, or everybody doesn't really need to be on medication. So that last one is self-care. Oftentimes, it's important for us to take care of ourselves and put ourselves first. Some of us may be parents or grandparents, great-grandparents, husbands, wives, and we're so used to taking care of everyone else that we're not doing a good job taking care of ourselves. So what I'm passing out to you is a self-care assessment. And we're not going to have time to do these here, but I want you to take the time to really think about how well how you're treating yourselves, okay? In different areas, like physical self-care. I have it's perfect, look. Okay. Oh, okay. And you may find that you are so excellent with physical self-care, but when you look at the psychological self-care section, maybe you could do a little bit better in that area. Or if you look at spiritual self-care, do you take time for self-reflection? Now, some of these things you may look at and you will say, I'd never do that. Then move on to the next one, okay? But some of these areas will have a bunch of zeros. In some areas, you'll see that you have a lot of threes. Okay, so if it's an area that you have a lot of threes in, then you know you don't have to mindfully and purposefully work on those areas. But sometimes we have an area that has a lot of zeros. And it might be psychological self-care. Do you take day trips? Do you make time for self-reflection? Do you go out into nature? Those things help our mental health. Yeah. So I hope that you find that useful. That's one of the things that I hand out quite a bit to my my patients. And we look at it and see what areas we can work on. So everything doesn't have to be medication. Sometimes it needs to be, because sometimes the depression is biochemical. And all the talking in the world is not going to change it. Okay? And if people are reluctant to do medication, therapists work with folks from where they are, and then go from there. And if they find that that treatment modality doesn't work, then they may decide, okay, I'll talk about medication now. And that happens quite a bit with some of the people that I counsel. So here's the good news. People can be successfully treated. And like you said, oftentimes that's the first line of treatment for moderate to severe depression. If someone is severely depressed, talk therapy may not be the best first line. Okay, it just depends on the individual. People can improve. Okay, and a combination of psychotherapy, psychopharmacology can improve the treatment response. So if someone is depressed, it's not the end of the world. It is a treatable medical condition. Are there any questions? That's the good news, yes.
When you lose family members, and what is the difference between grief and depression, and how long does it take?
Yeah. So grief can cause depression. When you lose a loved one, there is grief and loss, and it's very real. And you may be feeling a little bit better in 2 months. That, young man over there might be feeling better in 6 months. Some people, it may take a year, okay? But when it's at the point after a reasonable amount of time, and it's different for everyone, if you're still debilitated and you can't do your daily functions, it's time to seek some counseling or seek some help, okay? And there are a lot of excellent grief counselors here in Northeast Ohio. Okay, so there's no reason for anyone to suffer. And sometimes when people have a loss, a major loss of a loved one, counseling and short-term medication, you don't have to stay on it forever. You just may need some help to get you through. And one more thing I'll say about grief and loss. No one can tell you or me how long to be sad, how long to grieve, how long to be upset, how long to be talking about the loved one. If it's someone in your family, someone who loves you, someone who knows you well, and they see that it's being protracted and you can't get it together after a period of time, then it's up to the loved one to say, hey, why don't we go get some help for you, okay? But sometimes people think that they can tell you, oh, you should be over that by now. Why are you still sad? That was 6 months ago. Right. Right, I know. And so I'm telling you, don't listen to those people. Some of them say that because they're uncomfortable talking to you because they haven't experienced it, okay? So that was a good question, thank you. It's very difficult, but there are a lot of grief counselors, counselors, therapists, psychologists who are expert in dealing with the grief process. Not everyone is, okay? So here's just a little plug for our Center for Behavioral Medicine. The number for appointments is on both of those handouts that I gave you. And it is called the Center for Behavioral Medicine. That's where you get your counseling, get diagnosis. There are a lot of different services that are available. And we have a lot of resources available. No one should be feeling depressed and feel like they don't have a place to go or a place to call. And a lot of the places that you can call are included in some of your handouts. In the green and white pamphlet, it's a program that's available to us that's called NAMI, N-A-M-I. And if you're depressed, or if you know someone who's depressed, if you have a family member who you know is depressed and you need support, that would be the perfect organization to call. Yes?
There's a local NAMI too. You have the Cleveland one here, but there's one in Lake County.
Excellent. Mm-hmm. Excellent. NAMI. And that's the green and white. They have a lot of great resources. And with that, we're a little bit over the hour. Does anyone have any questions or words of wisdom for the rest of us here? Okay, well, I'd like to thank you so much. Thank you.